for coming this evening to our asthma health awareness event. My name's Louise Tomko. I'm a geriatrician and I work at Salford Hospital. A geriatrician means I'm a doctor who looks after older people. So I am not an expert here tonight, so don't ask me any questions about lung health. This is your panel of experts, and what a panel indeed. I'm going to let them all introduce themselves as I pass the mic over shortly. But just to say, we also have Living Well and Big Life in the corner over there. Hi. And please do make sure you visit that stand. They're giving some really good general health advice and specifically around smoking cessation or stopping smoking tonight. We also have Councillor Ashad in the room. Just like to say hello to everyone. Great, thank you so much for joining us. We really appreciate your presence. Without further ado, I'm going to hand over to the panel of experts. And again, thank you all for coming. I'll let you introduce yourselves and take it away. Thank you.
Thank you very much for inviting us today. My name is Ran. I'm one of the asthma doctor looking after adult patients, and I work in South Manchester with Insure Hospital.
Hi, my name's Claire. I'm a children's asthma doctor and I work at Manchester Children's Hospital in central Manchester.
Hi everybody, thank you for inviting us. I'm Leanne. I work as a nurse looking after adults with asthma and I'm based at Manchester with Insure.
And I'm Paul Marsden. I'm a lung doctor and I mainly look after people who have a chronic cough, and I work at Insure Hospital as well. Is this over?
Hi everybody, Assalamualaikum. I'm Huda Badri. I'm also an asthma doctor, but I specialise in patients with work-related asthma and work with these guys at North Manchester. Here we go. On the clock. Okay, that's fine. So we have a short talk for you, and then we'll have an opportunity for you to ask questions, and I'll direct those to the panel. So just bear with me with the talk. So we're going to talk about asthma and why that's an important condition for us all to be aware of. So we've translated the slides, so I'll stop in case people want to read those as well, but do stop me if I'm going too fast. So we've introduced ourselves, so I don't need to dwell on this slide for very long. Oh, you can do if you want. I'm just saying yeah, no problem. I can come back. Go ahead. We've introduced ourselves, so I'll skip past this. So what is asthma? So asthma is a very common condition and it's a long-term problem. So people have that all the time. You don't get cured of it, if you like. And it really is a problem to do with our breathing. When we breathe, we have the lungs and we have tubes within the lungs that help get air from the atmosphere into the body. And then take out the exhaust gas from the body. And in asthma, these tubes can get swollen and they can cause problems with breathing, especially if they become too narrow. The narrowing of the tubes affects how much air is getting in and out of the body and causes problems with breathing. And it affects lots of people in the UK. So 1 in every 12 adults has asthma in the UK, and 1 in every 11 children has asthma, so it's a very common condition.
you want like a verbal translation as well as reading, or how would you like to do it?
ਪੁੱਛ ਰਹੇ ਕਿ ਤੁਸੀਂ ਕਿਸ ਤਰ੍ਹਾਂ ਪਸੰਦ ਕਰੋਗੇ ਪਾਣੀ ਗੁਲਾਬੀ में तारा गल करांगे पढ़ लो फिर समझ आ जाएगी मैं बताऊं आपको
Yeah. No problem. That's whatever gets the information easier.
I think I'm going to start on that side to read it.
That's absolutely fine.
So I think I'll write in English.
Okay. Yeah, that's fine. Go ahead.
उर्दू बोलो पंजाबी मेरे उर्दू उर्दू अच्छा ये जो दमे की बीमारी है उससे कह रहे हैं कि काफी लंबी बीमारी होती है यानी कि आने वाली जिंदगी वो चलती रहती है इसमें ब्रीदिंग का मसला बनता है जो फेफड़े ना फेफड़ों के ना यानी कि ऑक्सीजन नहीं जाता तो ब्रीदिंग का मसला बढ़ जाता है लोग ब्रीद नहीं कर सकते ट्यूब्स कैरी आउट ये जो ट्यूब्स होती हैं जो लंग्स के फेफड़ों के अंदर जो नाड़ी होती है उनमें हवा जाती है जिसकी वजह से बंदा ब्रीद करता रहता है ठीक है अगर ये कभी कभार ये जो नाड़ें सुंगड़ जाए या सूजन पड़ जाए इनमें तो ज़्यादा सांस लेने में मुश्किल बन जाती है दिक्कत हो जाती है दिस मीन्स के इसका मतलब ये है कि फेफड़ों में कम हवा जाती है कम ऑक्सीजन जाता है और कम मसला बनता है ब्रीदिंग का तो 12 में से एक बंदे में यूके में यानी कि अडल्ट छोटे बच्चे नहीं बड़ों को ये मसला बनता है ठीक है
So when you have asthma, what symptoms, how does it make you feel? So people can complain of wheezing, which is difficulty or noisy breathing that they have. Yeah.
No, you. अच्छा जिन लोगों को दमा होता है उनके तासरात ये नजर आते हैं यानी कि विजिंग सांस होनी शुरू हो जाती है चेस्ट टाइटनेस खींचना सीना जो है खींच हो पड़ जाता है उसमें खांसी शुरू हो जाती है शॉर्ट होकर सांस लेने में दिक्कत शुरू हो जाती है ये इसके सिम्टम्स है
So we mentioned wheezing,
Yeah.
cough, tightness in your chest, and shortness of breath. Now, these are very common symptoms to other conditions as well, not just asthma.
ये जो बीमारियां सिर्फ दमे के लिए नहीं और भी कहीं भी बीमारियां हो सकती हैं जिसकी वजह से ये मसले बन सकते हैं सिर्फ दमे के लिए ये मसले नहीं बनते
So it's really important to get the diagnosis right to be sure that it's asthma.
कहते हैं बहुत जरूरी है कि आप इसका पता करवाएं ये बीमारी डॉक्टर के पास जाए मुझे ये मसला हो रहा है क्यों हो रहा है क्या वजह तो मजीद इन्वेस्टिगेशन करेंगे
So how does the doctor find out that you have asthma? How do we diagnose asthma? So when you see your GP or the doctor, the most important thing is finding out what symptoms you have. So which of the symptoms we mentioned you have.
कहते कि जब जीबी के पास जाएं तो आप उसको अपने तासरात सारे बताएं कि मेरे साथ क्या हो रहा है खांसी हो रही है या सांस नहीं निकल रही ताकि उसको पता चल जाए आपके साथ क्या मसला हो रहा है
So it's really important to tell them about all of these symptoms.
बहुत जरूरी है कि आप ये सारी बातें जो हैं ये तासरात है ये डॉक्टर को बताएं
And then they might do some very simple tests of your breathing to see how good your lungs are working. And they may also do some blood tests as well.
कहते हो सकता है कि डॉक्टर जब वो सिंपल सा टेस्ट करे आपके सांस का रिपोर्ट या फिर ब्लड टेस्ट ले मजीद तसल्ली करने के लिए
So lots of things can make asthma worse or in some patients cause asthma. And these are things that we come across in our daily life. So having a cough or a cold or the viruses or bacteria that causes these infections can make asthma symptoms worse.
कहते ये जो सारी चीजें ना इसकी वजह से अस्थमा के तासरात आ सकते हैं जैसे ये कि सर्दी में खांसी शुरू हो जाए मौसम की वजह से सिगरेट पीने से वेपिंग से और डस्ट से माइट से डैम्प मोल्ड क्लीनिंग पाउडर कुछ चीजें होती है सफाई करने वाले उनसे भी कभी कभार इंसान का मसला बन जाता है स्ट्रेस से भी हो जाता है और जो कुत्ते बिल्ली लोग रखते हैं उनसे भी ये आउटडोर पोल्यूशन जो बाहर की गर्दोनुमा है पोल्यूशन उसकी वजह से भी हो सकता है और फिजिकल एक्टिविटी से जाते हैं वॉक पे जाते हैं She's looking at me, she knows we go for a walk.
So just to recap for everybody else, the changes in the weather, so now that we've got the colder weather, that can sometimes affect people. Some patients complain about hot weather affecting them as well. smoking is really important, and vaping and e-cigarettes, all of those things can make asthma symptoms worse.
कहते ये सारी चीजें करने के लिए जैसे सिगरेट हो गया, मौसम की वजह से, पोल्यूशन की वजह से दमे के तासरात जो बढ़ सकते हैं. Yes.
Things that we use at home, like cleaning products, can also trigger asthma and make asthma worse in some patients.
कहते घर में हम जो सफाई करने वाली चीजें इस्तेमाल करते हैं, डिटर्जेंट हो गया, जो भी हम, उससे भी कोई लोगों का जो दमा जो है वो बढ़ जाता है.
And sometimes when you do very strenuous physical activity, it can bring on asthma symptoms as well.
कभी कभार एक्सरसाइज करते हैं, एक्टिविटीज करते हैं, उससे भी सांस फूलने का मसला बढ़ जाता है, यानी कि दमा बढ़ सकता है.
I think you mentioned the pollution and stress already.
गर्दन मार जाता.
So what things can we do to try and keep ourselves well? So lots of these apply to all medical conditions. So it's really important that you take your medications, and especially inhalers for asthma, regularly and as prescribed by your doctor.
कहते हैं कि अपनी दवाइयां जो है वो सादगी से लें, जो दमे के लिए ले रहे हैं, ठीक है, वो जरूरी है. इनहेलर वगैरह हो गए, जो भी लेते हैं आप दमे के लिए, वो लेते रहें. अपने आप को थोड़ा सा मसरूफ यानी कि एक्टिव रखें, चलते फिरते रहें, कुछ ना कुछ करते रहें, ठीक है.
If I just go back to the active bit, I think
All
you
right.
mentioned
We'll
it
do the
last
first
time.
one. Sorry.
Because we mentioned in the previous slide that sometimes physical activity, so being active, can bring on asthma symptoms. However, it's really important to keep active because that's one of the best ways of maintaining your general health. So you shouldn't stop doing activities.
Yeah. कहते हैं कि जिन लोगों को दमा जरूर ऐसा करें कि एक्टिव रहें. एक्टिव रहने से ये होता है कि दमे का अटैक इतना ज़्यादा नहीं होता. इंसान की सेहत ठीक रहती है, वो चलता फिरता रहता है, फेफड़ों में फेफड़े अपना काम करते रहते हैं, ठीक है.
And keeping our weight at a healthy level, so not being overweight or underweight, is also really important as part of your
वजन का भी ख्याल रखें. अपना वजन ज़्यादा ना बढ़ाएं कि ज़्यादा वजन बढ़ने से भी दमा जो है वो यानी कि वो बढ़ जाता है, ज़्यादा हो जाता है,
And
हो जाती है.
And if you are smoking, stopping smoking is really, really important.
सिगरेट पीते हैं तो अभी से फौरन सिगरेट छोड़ दें, कि उससे वजह से भी दमा हो जाता है, आँख होना शुरू हो जाती है.
And keeping up to date with your vaccinations, like the flu vaccination
तो
and
ये
your
सालों साल जो
COVID.
टीके लगाते हैं फ्लू के, जो फ्लू के टीके सालों साल लगवाते हैं ना, वो लगवा लिया करें ताकि आप महफूज रहें बीमारी से.
So the next bit, we're going to try and clear up some misunderstandings that people might have about asthma and breathing problems.
कहते हैं कुछ लोगों को अगर समझ नहीं है दमे की, उसके बारे में मजीद आप
So when we see patients in clinic, sometimes they say, well, people have asthma when they're very young children, but they don't have it as an adult. You can't have it as an adult. So sometimes patients have that belief.
कभी एक बार लोग सोचते हैं कि हाँ ये हमारे बच्चों को दमा हो गया, अब हुआ है, हो सकता है 2-4 साल के बाद ये खत्म हो जाए. लोगों की ऐसे सोच भी है ना, लोग कहते हैं ना कि बच्चे को दमा हो गया, हो सकता है 2-4 साल के बाद खत्म हो जाए. ऐसी बस हमारा अकीदा यानी कि हमारी सोच है.
But actually, that's not correct. You can have asthma at any stage of your life.
तो ये सही नहीं है, किसी भी उम्र में आपको दमा हो सकता है, बच्चा हो, बूढ़ा हो, किसी भी उम्र में दमे का मसला बन सकता है.
If you remember from our first slide, we said that it's common both in adults and in children. And actually, even if you didn't have it as a child, you can develop it as an adult.
कहते हैं दमा जो किसी को भी हो सकता है, जरूरी नहीं कि बचपन में भी हुआ तो आपको अगली उम्र में आकर हो जाए. तो ये किसी भी उम्र में हो सकता है.
There is true that often children can grow out of asthma when they reach high
ये
school.
भी सही है कि कभी कभार बच्चे जो है ना थोड़े बड़े होते हैं तो वो दमे से निकल जाते हैं, उनकी बीमारी जो है वो खत्म हो जाती है.
It can be different. How asthma in childhood compared to in adults can be quite different. So it's really important that to see your doctor early on, and there may be other things for adults that cause the asthma that are very different to children.
कहते हैं बच्चों का बड़ों का जो दमा है वो मुख्तलिफ है, ठीक है. बच्चों का दमा होगा शायद थोड़ा सा डिफरेंट हो, मुख्तलिफ हो, उसके लिए जरूरी है कि आप उनको डॉक्टर के पास लेकर जाएं, क्या करवाएं.
You should always go to your GP if there's been any changes in
कोई
your
मसला हो,
symptoms.
कोई तब्दीली हो तो आप डॉक्टर के पास चले जाएं.
But the next one that we have sometimes, which we kind of answered now, is if you have asthma, exercising can be harmful. So people might worry about exercising if they've got asthma.
कहते कुछ लोग हैं जिनको दमा होता है वो एक्सरसाइज करने से डरते हैं, पता नहीं मैं एक्सरसाइज करूंगी शायद मुझे सांस ना मेरी फूल जाए, ऐसे ये चीजें लोग सोचते कि ऐसा हो सकता है।
But actually, that's not necessarily true. It's really important that you keep active for your general health.
कहते ये सही नहीं है क्योंकि अगर अस्थमा है भी है तो फिर भी अपने आप को आप एक्टिव रखें, एक्सरसाइज करें, इससे ये ना डरें कि मैं एक्सरसाइज करूंगी तो शायद मेरा दमा ज़्यादा हो जाएगा, ये जरूरी नहीं है। अपने आप को एक्टिविटी जो है आप जारी रखें अपने।
That will help keep your lungs fit and active.
इसके एक्सरसाइज करने से ये होगा कि आपके फेफड़े जो है ना वो सेहतमंद रहेंगे।
But if you are worried about exercise and you have asthma, then it's important to speak to your GP or your asthma nurse about that.
अगर एक्सरसाइज करने से आपको खतरा है, ये फिक्र है कि मैं एक्सरसाइज करूंगी शायद मुझे ये हो जाएगा, ये हो जाए, इससे पहले आप ऐसा करेंगे, आप जीपी से बात कर लें, उससे मालूमात ले लें, इंफॉर्मेशन ले लें डॉक्टर से।
Because we might be able to recommend things that are more suitable for you.
हो सकता है डॉक्टर कोई ऐसी अच्छी राय दे दे, ऐसी कोई चीज़ दे दे आपको दमा बेहतर करने के लिए जो आप एक्सरसाइज करें।
So this one is one that we see a lot. I only need to take a blue inhaler, or just one of my inhalers.
ये वाली जो बात है ये बहुत जरूरी है कि हम लोग ये ब्लू इनहेलर देते हैं, हम लोग ये समझते हैं कि हमें बस हमारे लिए ये ब्लू इनहेलर ही ठीक है, हमें मजीद और कोई इनहेलर लेने की जरूरत नहीं है।
So the blue inhaler helps when you're struggling for a short period of time, but it actually doesn't have the right medicine to fully treat your asthma.
कहते हैं जो ब्लू इनहेलर जो है जो वक्ती तौर पर इस्तेमाल करते हैं, जैसे कि आपकी सांस जल्दी फूल गई है और सांस नहीं ले रहे, ब्लू इनहेलर वो जो इमरजेंसी के लिए था तो वो आप फौरन ले लें उसको, लेकिन इसका मतलब यही है कि वो आपके फेफड़े का इलाज कर देगा, ठीक है, वक्ती तौर पर वो आपको आराम आ जाएगा।
So you need to take all of your inhalers as prescribed to stop your asthma symptoms coming
कहते हैं
back.
कि जो डॉक्टर ने आपको इनहेलर्स दिए हैं इसके अलावा और भी हैं वो आप बाकायदगी से उनको इस्तेमाल करें ताकि उससे आपको दमे का फायदा रहे।
So people with asthma, or most people with asthma, will need to take their inhalers every day.
कुछ लोगों जो दमा है वो लोगों को चाहिए वो अपना इनहेलर जो है वो रोज लें, जैसे कि डॉक्टर बताता सुबह लें, शाम को लें, सुबह बाकायदगी से लें, भूल ना जाए, छोड़े नहीं उसको।
Even when they feel fine, so it's not just when they're poorly.
जब आप ठीक भी हैं, राइट, ओके, 2 इनहेलर देते हैं ना डॉक्टर सुबह को इस्तेमाल करने के, रात को इस्तेमाल, बेशक आपकी तबीयत ठीक है, लेकिन फिर भी आपने उन इनहेलर को आपने यूज करना है, छोड़ना नहीं, चाहे आप ठीक है नहीं ठीक, वो छोड़ने नहीं आपने।
And you should take your inhalers just how your doctors prescribe them for you.
इनहेलर वैसे ही इस्तेमाल करें जैसे आपको अपना डॉक्टर हिदायत देता है, उसी तरह इस्तेमाल करें।
So I think we've touched a little bit on this, isn't it? So patients sometimes say, I can stop taking my inhalers now, my medications now, because I feel better.
कहते हैं कई लोग जो है वो उनकी अपनी सोच होती है कि मेरी तबीयत ठीक है, मुझे इनहेलर लेने की जरूरत नहीं है, ठीक है, तो ये ना करें।
So again, that's wrong. It's really important that even when you're better or you feel better, especially for conditions like asthma, that you continue to take your inhalers and you don't stop them unless your doctor changes them.
कहते ये कि सही बात है कि अगर आपकी तबीयत ठीक भी है, आपने खुद अपने इनहेलर नहीं छोड़े, कि कभी नहीं सोचे हाँ जी आज मेरी तबीयत ठीक है, मैं अच्छी फील कर रही हूँ, मैं नहीं लूँगी, ये वाला काम नहीं करना। अगर छोड़ने पड़े तो वो आपको जब डॉक्टर हिदायत देगा कि हाँ भाई मैं समझता हूँ कि इनको कम करें छोड़े, फिर आपने करना, खुद अपनी तरफ से कुछ नहीं करना।
Because even when you feel well with asthma symptoms, if you stop taking,
भी है आपकी तबीयत, आपने तब भी अपने इनहेलर लेने।
if you stop taking the medications, it can still be harm to your lungs going on.
अगर आप नहीं लेंगे तो ज़ाहिर है कि दूसरे तीसरे दिन आपके लंग्स जो है वो दोबारा बढ़ना शुरू हो जाएंगे, मसला खड़ा हो जाएगा दोबारा।
If you're feeling better, if you're wondering about the medications that you're taking, you need to speak to your GP or your asthma nurse, and they may be changed at that stage.
कहते हैं कि अगर आप इसके बारे में कोई फिक्रमंद है तो अपने डॉक्टर से या डायबिटीज नर्स से बात कर लें,
No, asthma nurse.
अस्थमा नर्स से बात करें आप, ठीक है, तो वो आपको बताएगी कि आपने इसको कम करना है या ज़्यादा करना है या जैसे रखना है, उससे बात कर लें।
So this is one that sometimes that people may think, because asthma is so common, asthma isn't that serious.
कहते कुछ लोग समझते हैं कि हाँ अस्थमा पता नहीं क्या इतनी बुरी बीमारी है, कुछ ऐसा कुछ बात ऐसी बात नहीं है, अस्थमा जो इतनी लंबी चौड़ी बीमारी नहीं है, यानी खतरे वाली बीमारी नहीं है।
So if asthma is not controlled properly, and if people are exposed to triggers and not taking their inhalers, it can have very serious effects. It can have a very serious asthma attack that can be quite dangerous.
कहते हैं कि जब आसमा ट्रिगर करता है, ट्रिगर का मतलब है कि जब आसमा शुरू हो जाता है किसी वजह से, तो उससे ज़रूरी है कि आप अपना inhaler
question.
asthma
it's
triggers is not managed in the way right. अगर ज़्यादा मसला बन जाए, अगर आप नहीं संभाल सकते उसको, जो नहीं है फॉलो हो रहा है इसका, तो फिर you have to very serious about it.
Yeah, you can have
और
very
जिसमें
serious
काफ़ी
effect.
सारे नुकसान पैदा कर सकता है ये.
It's really important that we are sure about the diagnosis and you've got the right diagnosis and you've got a personal plan to manage your asthma.
कहते हैं कि आपको पता होना चाहिए कि आपको अस्थमा है, डॉक्टर ने आपको बताया है आपको अस्थमा है, तो उसके लिए आपको इसको सीरियस लेना चाहिए. अगर मैं कुछ मिस कर लूँ तब उर्दू में पढ़ सकते हैं.
We're going to come to some we're going to give you
आगे पीछे हो जाता है.
we'll give them an opportunity to ask questions in a moment. So I'm going to stop talking a little bit, but I just wanted to highlight that our team does lots of research in asthma to try and help people with their condition, but also understand a bit more about asthma.
कहती है हमारी जो टीम है, हम काफ़ी सारी दवा के बारे में काफ़ी रिसर्च करते हैं, काफ़ी सारी चर्चा कर देखते हैं, सारा तो देखते हैं,
and we can leave some
ताकि लोगों को दमे से बचाएं, उनको बेहतर बनाते हैं.
And if people are interested in finding out about the research, we can leave some information for them to contact
अगर
us.
लोग खुद चाहते हैं कि वो खुद रिसर्च करें इसके बारे में, तो कहते हैं हम इन्फॉर्मेशन छोड़ जाएंगे, आप खुद रिसर्च करें.
So we're going to give everybody an opportunity to ask questions now. You've got the expert panel to answer.
अच्छा, ये सब तजर्बेकार प्रोफेशनल लोग बैठे हैं. अगर आपने दमे के हवाले से कोई भी सवाल करना है तो आप इनसे कर सकते हो, मेरे थ्रू भी कर सकते हैं.
That was brilliant. I certainly learned some things. Does anyone want to start off with questions? And you can either use the microphone or you can not use the microphone, whatever you fancy. Has anyone got any questions for the panel?
कहते हैं कि किसी ने सवाल पूछना है तो आप माइक्रोफोन इस्तेमाल कर सकते हैं, तो माइक्रोफोन के बगैर सवाल करना तभी कर सकते हैं.
Does anybody know someone with asthma?
सब लोगों
Do you want to put your hand up if you know someone with asthma? Okay. It's like pretty most people in the room. Did you learn something new about asthma tonight that you didn't know before you came?
हाँ, ये दमे के बारे में कोई नई बात सीखी आप लोगों ने?
You got a question? Has anyone got a question? Yes. Thank you.
Thank you. My name is Gonza. We get quite a lot of casework, obviously, with regards to the mold in the house. And I wanted to know, and especially you guys didn't want to know, what effect it has on the lungs, especially when the property's got the mold, and what kind of treatment or what they can do to minimize the risk, especially damage to the lungs.
Does anyone on the panel want to take that question about housing, mould and the impact on lung health? Thank you very much.
Hi, that's a really good question. When you have asthma or any lung condition, if you're exposed to mold and you're breathing it in, it can actually worsen the condition. And there's been some recent changes in law. I think it was Nawab's law of a young boy that died unfortunately because of mold. And now landlords are legally obliged that they should get rid of that mold. Washing it away isn't going to make it go away. It usually needs a lot more treatment doing. So I would say if you have respiratory condition, lung condition, and you have mold in the home, then you need to highlight that to your landlord, but also speak to your medical team as well, whether that be at the hospital or your doctor or your nurse at the surgery, because they can provide letters to help to support you as well. But definitely don't ignore it. There is something that can be done and that should be done now, and there's law to put that in place. Anybody want to add to that?
Really good advice about taking mould seriously. Would you mind just summarising the question and the answer?
Okay.
You don't want the mic?
No, leave it. I'm sure they can hear me. डंप के बारे में बात करें, जिन लोगों के घरों में डंप होता है, घर में डंप हो उससे दमे पे ज़्यादा असर पड़ता है, उससे ज़्यादा खराब हो जाती है, जैसे उसने बताया मौत भी हो जाती है, दरवाजे डंप हो जाए. अगर घर में डंप है, ऐसा कोई हमेशा है आपको, तो आप अगर प्राइवेट मकान में रह रहे हैं तो अपने डॉक्टर से बात करें. अगर अपना मकान है तो उसको ठीक करवाएं. अगर दमा है आपको, अगर किराए पे रह रहे कौन सा कम काम उनको बता सकते हैं भाई हाँ इस घर में क्या है इससे बच करें.
Great, another question.
Trying to get all the knowledge I can tonight. So someone I know suffers from asthma, also has type 2 diabetes and arthritis. I was wondering how asthma, suffering from asthma, could impact these other issues that she has.
Feels like a medical exam question. I like it. Who does like? Let me think. Would anyone in particular like to take that question about how having more than one condition can impact your overall health and how those conditions interact with each other? Yeah, Fab. Thank you.
Well, it's a really good question. Do add to my answer if there's a different answer to this. But with diabetes, asthma, and arthritis, we tend to treat them as separate diseases. However, the treatment for asthma, for example, if you have a flare-up of asthma, the treatment for asthma would be steroid, and quite strong steroid that you have to take tablets for. Now, that sometimes can make your blood sugar go up and affect your diabetes. And therefore, it's really important actually to keep having the inhaled steroid to prevent an asthma attack. Does that make sense? Oh, yeah. So the other thing is the inhaled steroid, it doesn't get absorbed into the bloodstream that much, so it doesn't affect your blood sugar level. But the tablet version of steroid does affect your blood sugar level, so it's quite important to control your asthma better when you have diabetes, because the tablet version of steroid can make your sugar level very high.
Yeah, please.
सवाल ये था कि वो कह रही है अगर इंसान को एक दो ही बीमारियों जैसे डायबिटीज होता है, दमा भी है, आर्थराइटिस भी है, कहते हैं कि अगर आपको दमा है, अगर उसके लिए अगर ऐसे तो फर्क नहीं पड़ता, ये तो मुख्तलिफ बीमारियां हैं, डायबिटीज का भी है, दमा जाता है, अगर खुदा ना खास्ता अगर दमा आपका ज्यादा हो गया तो आपको हमने स्टेरॉइड दिए खाने के लिए, छोटे छोटे टैबलेट में स्टेरॉइड दिए, अगर स्टेरॉइड दिए तो उसकी वजह से आपकी शुगर लेवल तो इससे बेहतर है कि आप अपने दमे को कंट्रोल में रखें.
I think there's quite a few other ways that they could interact. I'm just like, as you're talking as well, I think if you have diabetes as well, you might be more likely to get infections in the first place. So the diabetes might affect your asthma and cause more flares. There's definitely an overlap with the arthritis as well in terms of bone health. There's lots of different ways that you could answer that question. It's a really, you should write medical exam questions, honestly. It's a very, very good question. I'm going to... you for the GMC? Just quality control. I'm going to pass you back to the panel. Thank you.
So I was just thinking of another interaction there, because sometimes when you've got arthritis, then you take painkillers like Nurofen and ibuprofen and things like that, and sometimes some people with asthma, that makes their asthma worse. So again, if you've got those conditions, it's really important to talk to your doctor about what things are safe to take and not take. And of course, if you've got bad arthritis, then it's harder to exercise as well, isn't it? So that can just make your general health worse and make your asthma worse. So yeah, really lots of ways those things can cause a problem. So let's just hope we don't have all three of those at the same time.
Let's do a summary of that.
अच्छा वो ये कह रही है कि अगर आपको आर्थराइटिस है, जोड़ों का दर्द, इसके लिए ibuprofen खाते हैं, वो न्यूरोफिन, अगर ये टैबलेट्स आप खाते हैं, इसका दमे पे असर पड़ सकता है, दमा आपका ज्यादा हो सकता है, ठीक है. ट्राई करें, डॉक्टर के पास जाएं, उनसे पूछें, पूछकर खाएं कि मुझे ये टैबलेट खाओगे क्या कर सकते.
I think it makes controlling all of those chronic long-term health conditions important, and Huda's earlier point about not stopping your tablets when you feel better is really important, because a lot of these conditions require you to take tablets long-term, so speaking to your doctor about that and staying on the medication even when you feel better. And then I've got-
Yeah, I just wanted to ask, like, how important, like, the environment, that we keep ourselves in, because you said earlier in your presentation, from adults and children, it differs. So, would you say, like, carpets and stuff like this, the kind of environment you are in, affects? Laminate floorings and stuff like that. So, could you advise? Is there kind of key steps that we should be taking in order to keep our environment kind of good?
No, it's DIY advice. Laminate flooring or carpet, which is best?
Does anyone want to take that question?
So I think it is really important, and it's important for both adults and children who have asthma. One of the things, if you've got asthma, it might be important to find out is whether you're actually allergic to things. So that might be, as in, not so much like foods and things that often when you're allergic to a food, you eat it, you know straight away that you're allergic to it. But things like pets and cats and dogs and house dust mite and grass pollens and tree pollens and molds that we talked about earlier. So it's really important to sort of try and find out if you are allergic to those sorts of things, because then you can try and do something to try and avoid them. And that might be, not going around to your friend's house who's got a dog because you are allergic to the dog. And unlike foods, those sort of allergens don't always happen, you don't notice a problem right away, but then maybe the few days after or the week after, your asthma might be worse and you might not quite put it together that that's what it was. So it is important to try and find out these things, and your doctor should be able to do some tests if you ask them for that. And then there's the thing about damp and mold in the house that we talked about. Again, a real problem for anybody who's got a lung condition. So if that is an issue, trying to usually the mold comes with the damp, so trying to get rid of the damp problem is the problem, and then you can clear the mold then usually. And then there are other things that are on the list. I'm trying to remember what else was there in the environment. So things like pollution. So we always talk about pollution, don't we? And we think about cars mostly and fumes from cars. So that might be that, you can't avoid them, obviously, all the time. But if you've got a choice when you're walking to the shops or taking your child to school or something, that you can go around a small, quiet street instead of up the main road where all the trucks are going and putting all the fumes out, then actually, that would be a better solution for you, probably. And then there are pollutions in our homes as well, and that might be cigarette smoke. It might be fumes from cooking. It might be because you've got a log burner or a stove that gives off a fire. So there might be lots of things like that. Could be things that are triggers for you. So trying to keep your house as free of those sorts of things. And also simple things like some people with asthma find things like detergents and sprays and things and strong perfumes can really irritate them. So we all like our houses to smell nice, but actually having a lot of things like scented candles and diffusers and things like that can actually make people who've got asthma feel worse. So trying to avoid those if you can. Maybe just, opening the windows for brief periods during the day to freshen the air in the house. So those are some sort of simple things that you can do. Anybody else got any other suggestions? Sorry, I'm sorry, you've got to try and translate that now.
These are all the things on the board which could cause asthma trigger. Yeah, like pollution, mold, detergents, damp, pollution outdoor. If somebody then take a picture of it, and then these are the triggers.
Can I add a little bit if that's
Yeah.
okay? Just there are other in terms of adults, there's other things that we're exposed to in the environment to add to everything that Professor Murray said. So certain jobs and exposure to certain dusts and fumes and gases in the workplace is actually an important cause of asthma for some adults as well, and an important trigger if you've already got asthma. So it's really important if there's been a change in your symptoms and you notice that your symptoms get worse at work and better when you're away from work, that you tell your doctor about that, because it may be related to something that you're doing in the workplace.
Yeah. यानी कि बड़ों को जो है वो काम की जगह पे भी मसला बन सकता है दमे के, जैसे गर्दोनुमा है, दूर थब्बा, इन चीज़ों से आपका दमा जो है वो ज़्यादा बढ़ सकता है। तो उससे बेहतर है कि आप डॉक्टर से बात करें। ऐसी चीज़ें आपको परेशान कर रही हैं तो आप डॉक्टर से बात करें।
Yes. Yeah, I'll come to you, then you. Fabulous, thank you.
I don't know the mic.
You don't need to take it off. Hi. Okay. Do you want to talk to us afterwards, maybe, not in front of everyone about that? Yeah, you can speak to talk to either anyone on the panel. Thank you. Come to you next. Don't need the mic. No one wants the mic.
This was the session. What I'm going to ask is, coming from you, and that affects my lung because of asthma as well. I've not recovered from it. I've had all the jabs, and I've seen a lot of people struggling with breathing. A lot of it can be connected. I'm not sure what research has been done regarding COVID.
Brilliant question. We did very briefly cover it, but only just to say that viruses can trigger asthma. So I think great question. Would anyone like to talk about research, COVID and asthma? Thank you.
Can maybe talk a little bit about kind of what we see in the clinic. And so I think the thing to say about COVID is it can affect the breathing and it can affect all sorts of other symptoms. So as I mentioned at the start, I look after patients that have a chronic cough, so that can't stop coughing, and we see that as well after COVID. There can be lots of different reasons why somebody's breathless after COVID infection. It can upset asthma or other airways diseases like you've mentioned. It can often affect the way people breathe as well, so the pattern of the breathing, which can make you feel breathless as well. And it can also be associated with other conditions like the heart, and it can sometimes cause blood clots within the lungs as well. So I think if you have any ongoing symptoms after an infection like that, it's really important that you see your doctor, because there's lots of different reasons why that might be ongoing, and the treatment really depends on what might be driving that. Anyone have anything else to add to that?
वो कहते हैं कि इसका कोई भी और भी वजह हो सकते हैं, जैसे आपका पेट का मसला पहले से है, आपका दिल का मसला है, आपका ब्रीदिंग का मसला है, तो ये चीजें और भी जो चीजें हैं वो अफेक्ट कर सकती हैं। तो इससे बेहतर है कि आप अपने डॉक्टर से बात करें, उससे रिव्यू लें कि क्या है। कहते हैं कि हाँ, सॉरी कहते हैं कोविड इंजेक्शन से ब्रीदिंग का मसला बन सकता है, लोगों को बन गया बन सकता है। So does COVID injection did affect
The COVID injection. I'm not aware of any evidence that suggests that. I think that's one of those common myths that people think the COVID injection caused problems with the lungs. No. Is there anyone from the panel who'd like to? No. Yeah. Yeah, I'll hand over to the panel. Yeah. And the studies you were asking about, sorry, I interpreted your question as being, is there any evidence around COVID itself and lung problems? Were you asking about the COVID injection?
I'm struggling with breathing. I go to the gym, I get me breathing back to normal. I've done football. Usually when you go to the gym, you can see several improvements in breathing. I'm not even breathing. So I'm a bit worried on that. I'm just trying to see if there's connection.
Sure, yeah.
That was
Yeah, okay, grand. Thanks. And sorry to hear you going through it as well. It's not good. I'm going to hand back to the panel with the question about the COVID injection or vaccination, another way of putting it. Yeah. Does anyone want to take that question? No.
I'm not aware of any research that connects the COVID injection to kind of chronic breathlessness. And like I say, if you've had COVID, we know that there's lots of reasons why you might be breathless after COVID. So if that's an ongoing symptom, like you've said, it's really important that you see your doctor about that and get checked out.
I think the recommendations would still be that people with lung problems get vaccinated. And there's lots and lots of evidence that shows that COVID itself and flu and other viruses cause long-term lung problems, but no evidence that the vaccines cause it. So I think the advice would be to get vaccinated. I know there's a lot of misinformation around vaccines as well, and a lot of fear around vaccines and concern, so I do totally get that as well.
If it helps, I'm a nurse, I have the vaccines. I'm not worried about the risk, and I think most of us here would say that as well. I wouldn't recommend something that I wouldn't be prepared to do myself.
I think that does help. I have the vaccines as well. Do you want to do any translation around that? That might be really useful actually.
अगर आपके साथ पहले से कोई मसला बना हुआ है, ब्रीदिंग का मसला बना और कोई मसले जिन्हें में है, तो उसकी वजह से ये जो असरात आपको आ रहे हैं उसकी वजह से हो सकते हैं, लेकिन वैक्सीनेशन से दमे पे कोई असर नहीं और मुख्तलिफ बीमारियां इंसान को होती हैं, दिल का मसला होता है और कई होती है जिसकी वजह से आपकी सांस का मसला बढ़ जाता है, तो ये इसके साथ उसको शामिल।
Does anyone have any more questions about the vaccine before we move on to talking about other things? Or I've still got.
Thank you very much. It's not a question, it's a comment. Because I caught COVID, but I'd already had the vaccination. And I can remember lying there in bed, sweating so poorly, it was untrue. I'd never felt that sick in all my life. And I thought, if I'd not had the injection and not had the vaccine, I wouldn't be here now. That's how serious it was. Thank you.
Yeah, I think that's really useful. Sorry. It doesn't. The vaccine doesn't stop you getting something, but it reduces the risk of it and reduces the severity when you do get it, so you're less poorly. So that's a really useful story. Thank you. Back to you. If nobody else, before you go into the second one, great. Thank you.
Couple of questions. Is there a genetic component to asthma? So if your mum has it, is there more chance of you developing it? Do antihistamines disguise asthma symptoms? And just the final one, mouth breathing or nose breathing? What would you recommend? I watch a lot of Andrew Huberman. So.
This is very technical.
No, sorry, so we can.
Okay, so okay.
Way too many questions in one go. So I'm going to talk about the nose, nose versus mouth breathing. I know I always describe to patients that the nose is the gateway to the lungs, and it's better if you can to breathe through the nose, because what the nose does is it warms the air, it gets rid of any rubbish that you're breathing in, and it's just generally better to breathe through the nose. Now, there are some people that can have quite bad, they can be quite snuffly and congested, and sometimes they need local steroid treatment to spray up the nose to help with the nose, to help them breathe. And so if people can, I would definitely say nose over mouth breathing. Anybody want to add to that? It's the gateway to the lungs. wants to take the gym?
So there was a genetic question, wasn't there? So is it genetic? So there definitely is a sort of genetic link, but it's not so clear cut as, you know, if your mum's got asthma, you'll definitely get asthma, or your dad's got asthma, you'll definitely get asthma. But definitely there are families who are more prone to developing asthma. What we know about asthma and how it develops is that the likely thing is that you've got some sort of genetic tendency to get asthma, and then something in the environment probably triggers that. So it's probably a combination of a genetic tendency and environmental. But we do see some people who come to clinic and have very obviously got asthma, and they don't know anybody in their family who's got asthma. So it doesn't always run true, but most people who've got asthma will be able to say yes, even if it's an aunt or uncle that they know, you know, there's somebody in the family. I don't know if that helps your question. And then there was another one was about antihistamines. Yeah, what was it? Can it disguise it? So I wouldn't say it can disguise it, no. What antihistamines are used to treat are allergies, really. And we know lots of people who have asthma, particularly children actually, are allergic to a lot of things. And the antihistamines help with those allergies, and therefore then subsequently help your asthma a little bit. So they can make a bit of a difference if you're quite an allergic person. And as Leanne said, a lot of the, you know, ideally breathing through your nose can help a little bit. And if you've got a lot of nasal allergies, taking an antihistamine can help unblock your nose a little bit, and then you can breathe a little bit more easily through your nose. Want to add anything to that?
Great. Does anyone else have any questions?
Thank you. I want to know if what's the physical activity we can do to help increase the lung capacity. I know there's a link between the regular exercises we help to overcome some of the asthma symptoms or effects. So which exercise will be beneficial obviously to reduce the breathing problems?
I think exercise differs from one person to another, and to do exercise doesn't mean that you need to put your trainers and your running gear on and go out and run a marathon. It can be as simple as just trying to be more active, walking around the park, walking the kids to school instead of driving to school, and it's just about increasing that physical activity and just trying to just do more generally. You don't have to join a gym, you don't have to run marathons. It's what you were able to do for you. For some people it could be quite physical exercise that they like to go to the gym and they're able to do that, but a lot of people aren't able to do that, so it's what is comfortable for you. But any activity that you can do that gets you moving is good for your overall health as well as for your breathing. Anybody want to answer that?
ज़्यादा का जैसे दवा पट्टी हो जिम में जाके दवा हो पहाड़ी चढ़ के दवा ये नहीं है लेकिन हल्की फुल्की एक्सरसाइज करें अपने आप को एक्टिव रखें।
I just want to add actually, maintaining a healthy weight is quite important, whether that's through being active or healthy diet. There's a clear association between high body weight, so obesity, with poor asthma control actually. So maintaining a normal BMI is really important.
अपने वजन का ख्याल रखें जितना ज़्यादा वजन बढ़ेगा इतने आपके फेफड़े जो है वजन को कंट्रोल में रखें वजन ज़्यादा हो तो आप जा नहीं सकते चलेंगे तो आपकी सांस फूल जाएगी
So we have a question at the back here whether particular clothing is associated with asthma. So does certain types of clothes cause asthma? Is that what does that mean? Does anyone want to answer that? Yeah, thank you.
सवाल किया उसने कि क्या कपड़े पहनने से जब इस किस्म के कपड़े पहनने से
So I would say in general, no, there isn't any particular clothing that you should avoid. I would say the only sort of thing that I can think of that might be related, I guess if you've got, a really dusty old coat that you haven't worn for ages and it's been gathering dust, and then if you are somebody who's allergic to dust and then you put that coat on, maybe that might upset you a bit, but I don't think there's anything in particular I can think of with anything that you should avoid.
Any questions from this side of the room? I've been quite biased to that side, haven't I? But it's into this side. Nothing? Okay, I think we'll probably wrap up there. I am certainly going to stay around for a bit. So if you had a question that you were too shy to ask, or it was more personal and you want to speak to someone directly, come and have a conversation with us. I'd like to start by thanking our fantastic speaker, Huda, and our fabulous panel, and our excellent interpreter. So if we just show our gratitude. Also, thanks to Living Well in the corner. Do drop by and say hello and get some valuable sort of lifestyle and smoking cessation advice. Thank you, as always, to Suhail, who puts in an incredible amount of effort in organising and promoting these events. Our unsung hero. But most of all, thank you to you for coming, spending your time, and for such excellent, engaged questions, and for listening, and hopefully you got out of it some new sort of pieces of knowledge, and please do take this and share it widely. Thank you so much.
The food, and before food, the feedback. So